Hi, I'm Bo Vinnerjung. I'm a visiting professor here in Ottawa from Stockholm University, Sweden. And that's where my funny accent comes from. I will talk a bit about the importance of school and education for kids from adverse family backgrounds, especially kids in out-of-home care. My colleagues and I in Sweden, we work with big data. We link national databases covering the entire population with each other. And that means that we have information that is based on total samples, not on selected samples. One of the things that we have found that has great bearing for child welfare and for work with any vulnerable population of children is that school performance at age 15, 16, that's what we have good data on, is a very powerful predictor of what happens in the future to children. Not just what kind of education they get or what kind of income they get, but a host of other things too. It's a very powerful predictor for suicidal behavior. It's a very powerful predictor for serious criminality, substance abuse, teenage childbirth, which has been known before, and like welfare dependency. And it's so strong that it actually cancels out, in our analysis, the impact of socioeconomic background. Saying this in more plain words is that if a child fails in school, she or he will have the same probability of ending up with drug abuse, regardless if the parents have a college degree or if the parents are sort of low blue-collar workers. So it is in school that kids are really in some way getting sorted for what happens in the future. There's a Norwegian sociologist called Ivar Frønes who has pulled all these data into a theory, and he says the school today in the knowledge society as opposed to the industrial society is the generator of marginalization. The next step is exclusion. Exclusion from the labor market and all the bad things that are associated with being excluded from the labor market. Now, this has pretty powerful implications for children from adverse backgrounds because they do really poorly in school. And that cannot be explained just by them having lower cognitive skills. That's not the explanation. We find, for example, that kids who grow up in foster care, majority of the boys do really poorly at school, and about 45% of the girls. And the correlation between their school grades and their cognitive capacity is far lower than it is for majority population children. We know that because we have data on IQ tests from conscription into the military, so we link that with a bunch of other data. When we look at how these children do, later in life, we see that they have high over-risk for just about anything you can think of. Suicide attempts, serious psychiatric disorders, welfare dependency, substance abuse, criminality, you name it. But when we look at the analysis, in our analysis, we look at the impact, the statistical impact of poor school performance in longitudinal settings, we find that poor school performance explains about half of the size of these over-risks. Now, we're getting pretty close to the same association as between smoking and cancer. When I grew up, having poor school grade was not a problem because I grew up in the industrial society. It was not a problem. If I wanted a job, I could just follow my mates in through the factory gates, and there'd be good, well-paying jobs waiting for me. Sometimes I would even get better training at these factories than I would get in vocational schools. Those days are gone. Today there are far fewer industrial jobs, and even those jobs require education and high skills training. So if we want to make life better for children from adverse backgrounds, if we want to improve their life chances, we simply have to help them do better in school. There are some interventions out there. The most well-researched interventions are tutoring, studies done by Robert Flynn here in Ottawa. That's why I'm here, to work with him. But there are also a host of other programs that are very promising in improving literacy and also actually numeracy skills with these children. And the window of opportunity to change things for these children is that they are underachieving compared to their cognitive capacity. The distance between their cognitive level and their performance level in school is pretty big, and it tends to be even bigger for kids who have good cognitive skills. So that's the window of opportunity for us. There are a lot of other things in these children's lives that we can change. Gender, if that's a risk factor, what are we going to do with that? We can't change their past. We can't change their genes, but we can change their school performance. We can improve their school performance. So if you want to make a difference for kids in out-of-home care and give them better life chances, help them do better in school. Thank you. And here is the equivalent of a footnote. The Swedish National Registers is a goldmine for research in both medical science and in social science. They contain data on the entire Swedish population. We have data on health, for example. Every time a Swedish person goes into a hospital, stays there overnight, we have data on them. Every Swede is assigned a 10-digit ID number from birth or a time of immigration that will stay with her or him until death. And this is how we link different national data banks. We just match them on their personal ID number. So samples that I work with usually constitute anywhere between 500,000 up to 2 million. I think that's a good size to work with. So now you know the basics about Scandinavian registers.